Have you ever wondered why depression is often referred to as the silent killer? This menacing moniker is not just a dramatic turn of phrase. There's a substantial truth buried within these words that we, as a society, must confront. Depression, an insidious and often invisible ailiness, is indeed an overlooked epidemic. Let's take a moment to consider the vast scale of this issue. Globally, it's estimated that more than 300 million people grapple with depression. That's roughly the population of the United States. Yet despite these staggering numbers, the conversation around this mental health disorder remains hushed, often relegated to the shadows. Depression is not merely a case of the blues that can be shrugged off after a good night's sleep. It's a serious mental health condition that can affect every facet of a person's life, from their relationships and work performance to their physical health. It can lead to a multitude of other health complications and, at its most severe, can even be life-threatening. In this video, we will delve deeper into the world of depression, shedding light on this silent epidemic. We'll explore its many faces, revealing the often misunderstood symptoms that can serve as red flags. We'll also discuss the various treatment options available, dispelling the myth that depression is a life sentence without parole. But why should you care? Because depression doesn't discriminate. It can affect anyone at any age from any background. Whether it's you, a loved one, a friend, or a coworker, understanding depression is the first step in combating it. Arming ourselves with knowledge is how we begin to break the silence, challenge the stigma, and promote mental wellness. Depression, a silent epidemic, continues to impact millions worldwide. But what exactly is depression, and how does it manifest? Stay tuned as we journey together into understanding this complex and deeply human condition. Depression isn't just feeling sad, it's a complex mental health disorder with a variety of symptoms. Let's untangle this knot together. Depression, also known as major depressive disorder, is a mental health condition that goes far beyond the occasional bout of sadness or grief. It engulfs an individual's day-to-day life, making it difficult to function or find pleasure in activities they once loved. Now you may be asking, isn't it normal to feel down sometimes? Absolutely. But the key difference lies within the duration and intensity of these feelings. Normal sadness is fleeting and grief gradually wanes over time. Depression, on the other hand, is persistent, often lingering for weeks, months, or even years. So, what causes depression? It's not a one-size-fits-all answer. Depression can stem from a combination of factors, including genetics, changes in hormone levels, certain medical conditions, stress, grief, or changes in your brain chemistry. It's like a jigsaw puzzle, with numerous pieces contributing to the overall picture. Let's talk about the symptoms. Depression isn't solely about feelings of sadness or emptiness. It encompasses a myriad of symptoms that can be both physical and emotional. This may range from loss of interest in activities, feelings of hopelessness, difficulty concentrating, changes in appetite or weight, to physical problems like headaches or back pain is not the same for everyone. Understanding depression is like navigating through a maze. It's complex, it's intricate, and it's different for everyone. But here's the thing, it's not an unsolvable enigma. It's a condition that can be managed and treated with the right help and support. Depression is often shrouded in misunderstanding and stigma, which can make those affected feel isolated. But remember, it's not a sign of weakness or a character flaw. It's a medical condition just like any other. Depression is complex and multifaceted, but recognizing its symptoms is the first step towards healing. Scene script. Depression can look different for everyone, but there are common signs to watch out for. Like a chameleon, depression often changes its colors. It doesn't always appear as a tear-streaked face or as someone hidden away in their room. Sometimes it's a smile that doesn't quite reach the eyes or laughter that sounds a little too forced. Depression is a complex condition with a range of symptoms. These can be physical, mental, and emotional. On the physical front, depression can manifest as constant fatigue, sleep disturbances, or changes in appetite. It can be that persistent headache that just won't go away, or a stomach that's always in knots. Mentally, depression can cloud your thoughts, making it hard to concentrate or make decisions. It can feel like you're wading through a thick fog, with everything seeming blurred and distant. Emotionally, depression can feel like a heavy weight pressing down on your chest. It can make you feel helpless, hopeless, or worthless. You might lose interest in activities you once enjoyed, or find yourself feeling irrationally guilty or overly critical of yourself. it's important to remember that these symptoms can be subtle and easy to overlook. Depression is a master of disguise. It hides in plain sight, often masquerading as just a bad day or a rough patch. But here's the thing. A bad day shouldn't stretch into weeks or months. A rough patch shouldn't leave you feeling empty or numb. If you or someone you know is experiencing these symptoms, it's crucial to seek help. Depression may be a formidable opponent, but it's not insurmountable. The first step towards winning this battle is recognizing the enemy for what it truly is. Depression is not a personal failing or a sign of weakness. It's a mental health condition, as real as any physical ailment. And just like any other health issue, it requires attention, care, and treatment. These symptoms are not a sign of weakness, but a call for help and understanding. Depression may be a formidable adversary, but it is not unbeatable. There are numerous treatment options available. It's essential to remember that each person's journey with depression is unique, and what works for one might not work for another. That said, there are common paths that many find helpful. Firstly, there is therapy. Cognitive behavioral therapy, or CBT, is a common method used to treat depression. It's a form of talk therapy that focuses on changing negative thought patterns and behaviors. There's also interpersonal therapy, which addresses issues in personal relationships that may contribute to depression. Medication is another treatment avenue. Antidepressants can help manage the symptoms of depression, making it easier for individuals to function in their daily lives. It's important to note that medication works best when used in conjunction with therapy. Beyond these, there are other treatments like electroconvulsive therapy, where small electric currents are passed through the brain to impact the brain's activity. This is usually considered when other treatments haven't worked. There's also transcranial magnetic stimulation, a newer method that uses magnetic fields to stimulate nerve cells in the brain. Of course, lifestyle changes can also play a significant role in managing depression. Regular physical activity, a healthy diet, adequate sleep, and reducing alcohol and caffeine intake can all make a difference. Mindfulness and relaxation techniques like yoga and meditation can also be beneficial. However, it's important to stress that seeking professional help is vital. Self-care and lifestyle changes are essential, but they are not a substitute for professional treatment. If you or someone you know is struggling with depression, reach out to a healthcare professional. They can provide a proper diagnosis and guide you toward the most effective treatment options for your specific situation. Remember, seeking help is not a sign of weakness, but a step towards reclaiming your life. A depression is a silent epidemic, but it doesn't have to be. It's an insidious condition that often goes unnoticed and undiagnosed, lurking in the shadows of our society. However, with understanding and awareness, we can bring it into the light, and that's what we've aimed to do in this video. We've explored the complexities of depression, a condition that's more than just feeling down or blue. It's a persistent feeling of sadness, a loss of interest in things once enjoyed, a struggle that millions face every day. Recognizing these symptoms, we've discovered, is the first step towards seeking help and initiating the journey to recovery. We've also peeled back the layers of depression's many faces. It doesn't discriminate. It affects people of all ages, from all walks of life. It can present as irritability in teenagers, as feelings of worthlessness in adults, or as physical pain in the elderly. Understanding this variability, we realize, is crucial in acknowledging and addressing this condition. Moreover, we've delved into the multitude of treatment options available, from psychotherapy and medication to lifestyle changes and self-care practices. There's no one-size-fits-all solution, but there are many paths to recovery, and each person's journey is unique. Emphasizing this point, we understand, is vital in empowering individuals to seek help and find the treatment that works best for them. But all this knowledge is futile if it remains confined within us. We must break the silence surrounding depression. We must talk about it, share our experiences, and listen to others. We must dispel the stigma associated with mental health issues and foster an environment of understanding and acceptance. Depression can seem like an insurmountable mountain, but with awareness, understanding, and the right support, it can indeed be scaled. By breaking the silence, we can help others find their path to recovery and contribute to a society where mental health is not a taboo, but a topic of open discussion. Depression can be defeated. Let's break the silence and shine a light on this overlooked epidemic.